STD rates are rising in the Central Valley, making early screenings more important than ever. I sat down with two community physicians who explain how a statewide program is expanding access to testing and helping patients get treated sooner. Talk to me about the partnership doing these screenings, right? So who exactly is involved? What does it look like and what does it entail?
Well, about 18 months ago, the state of California approached us and awarded us a grant called the EDSP grant. And that basically was our impetus for our hospital to start focusing especially on STDs. And that's where Dr. Dhillon has become just an amazing superstar, our clinical champion for the EDSP program.
And Dr. Dhillon, how do these screenings, also talk to me about them a little bit, and how do they benefit patients?
Yeah, so the idea behind this program is why it was even initiated or started. We noticed that majority of the patients, instead of going to primary care provider, especially in the Central Valley where we don't have a lot of primary care providers or a lot of population that's not insured, they use emergency department as their main care place. So that's what California as a state has noticed. So they said, okay, we are seeing increase in these diseases, which is HIV, syphilis, and Hep C, and we want to start screening these high-risk patients, or all the patients who are using the emergency department. Majority of them do fall into the category of high risk. So to catch them early, screen them, and start the treatment early so they don't have complications associated with those diseases later on.
What are some of the most common STDs that we are seeing in the Central Valley, and also how are screenings helping to prevent contagion, right?
Yeah, it's like any other any disease, any chronic disease we talk about, right? Prevention is the biggest thing. If you can't prevent it, you can at least screen it early. That's the most important thing. So if you catch it early, you can treat it early, and you can hopefully prevent the spread in your community and prevent any complications. So that's the focus of that. We see pretty much everything in this emergency department. We see a lot of gonorrhea, chlamydia. We see syphilis quite a bit. We do see HIV, but we see pretty much all of it.
And you sort of touched on this a little bit, but if you could elaborate a bit more on just why it's so important to do STD screenings, especially for that first step of just prevention, right? We want to prevent the disease from even just spreading further and further. So why would you say it's so important to have screenings like this?
I think when you're screening somebody, you're also educating them. So let's say somebody who's just recently became sexually active or doesn't know a lot about different STDs. I think that's where the physician has the opportunity to talk to the patient and not just say, hey, we're going to screen you for these diseases, but also tell them what those diseases are and how you can prevent from getting those diseases completely.
And I was thinking, as you were kind of talking through that, I feel like there's also this issue of a stigma behind getting screened. How can we move forward and away from that?
Thank you. That's so central, and that's something that I learned through my work with addiction. Is the very same sort of issues come up with patients disclosing about their drug use. And then that just gets kind of swept under the rug and not get treated until you get complications. And we've done a lot of work trying to educate ourselves and really learning patient-centered language, patient-centered strategies to help approach patients so that they feel comfortable. They know that they're in a safe space when they come into the emergency department to disclose, whatever behaviors they have. Sometimes there's a lot of self-stigmatizing that goes on. So we just want to make people feel safe, that it's okay to talk about these issues. And I think the very same things happen not only on the drug use side, but also on the STD and high-risk sexual behavior side.
I would say, like I tell all my patients, even not related to STDs, it's like, even if you feel totally fine, please make sure you see your doctor once a year, at least minimum, and get screened for these diseases and other chronic health conditions. So we can prevent just any complications potentially that are going to happen in the future. And just remember that as a physician, we're there to help you in any way possible we can. Majority of us will go out of our way to make sure that you get the linkage to care that you need, the treatment that you need, whatever that takes.